got an email. It was kind of a back and forth email with someone whose pet was given one of the flea and tick oral medications that we really recommend not using because of the toxicity of them. And hi, Forrest. And a couple of months later, the dog has vomiting, diarrhea, nausea, big lymph nodes all over the body, and so asked if that could potentially be related to being given a long-acting chemical insecticide, basically, parasiticide. And the answer is always yes, because that's something that stays in the body for a long time, and it causes damage to cells of the body. I don't care what the pharmaceutical companies are telling us. Any drug can have a reaction within the body, and any drug can cause problems for your pet. Their other dog in the same household ended up having anxiety and behavior changes, which that is something that we definitely see with these long-acting oral flea and tick products, some of the topicals as well. So I said, let's get some diagnostics on the dog, see what's going on. So she went in, and the veterinarian prescribed steroids and antibiotics, doxycycline, and said, well, I'm concerned that this could be a tick-borne disease. Okay, well, first of all, the dog shouldn't have any ticks if your chemical product that you prescribed is working. So it really shouldn't have tick-borne disease, but as we know, those products aren't that great at preventing tick-borne disease. But instead of testing to see if the dog had tick-borne disease, instead of doing an aspirate on the lymph nodes and seeing if they were just reactive, or if it was an infection, or if there potentially was a cancer like lymphoma, they just prescribed antibiotics and prednisone. And here's the thing. If the dog does have an infectious agent affecting the body, we just suppress the immune system. How is the dog supposed to fight it off? If the dog does have lymphoma and you start prednisone, then if you then get a diagnosis of lymphoma and you want to treat it, if you've already started the prednisone, you make your chemotherapeutic agents less effective. So this was a no win. We have suppressed the immune system. We may have screwed up chemotherapy if there is a lymphoma present, and we don't even know if, so our talk that we had with Dr. Dan Taylor over the weekend on the misuse of antibiotics, this is a clear misuse of antibiotics. We have no indication that there is a bacterial infection anywhere in this animal because, oh, by the way, no diagnostics, no tick panel, no CBC, no chemistry, nothing. This is a veterinarian who just prescribed medications with no clue as to what they're treating. So I will just beg all of you again and again and again and again, get diagnostics, insist on diagnostics. Now, if you want to go ahead and give your pet or have your pet prescribed something to make them feel better, like a non-steroidal anti-inflammatory or something to make them feel better while you're waiting for results, that's fine. But get your samples first. Get a urine sample, get a stool sample, get a blood test, get the aspirate out of those lymph nodes. That all can be done in 5 minutes at an outpatient visit. And then waiting 24 hours to get results and then treating effectively is so much better than just throwing drugs with no indication. So